workers at Kolebu Teaching Hospital. And then my uncle had a serious asthma attack. He was struggling not from Nana or pray, but because you people are on strike, you refuse to even take care of him. Even after his wife was demanding, say, she's going to pay every amount. Ye profession, we are all human. So, a young man at the age of 30 years, he married just 3 years ago. 3 years ago, so yeah, this December will be 3 years. He doesn't have a kid. He had an asthma attack. I can't tell you, say, you guys are on strike into unfun. Yeah, that must say he's dead.
Do you think the nurses for no treaty Ghana warfare? I must swear secret of oath. I say a secret of oath in the at all costs. You be bought Nippon Kwan buy. We are sure, say, secret of oath no Mosweno, Omudiso, and as a mobility.
Omo person omoji tools allowance. Now, omo 7 Ghana cedis per day. Pacho, nurse na or quite more than a panny free vehicle. No, the microphone or point was under the
The leadership of nurses, they are using the young nurses to do politics. And in the Yemiya, I don't have any problem with a young nurse. The young nurse is relying on their leadership. But the leadership there is not thinking about the young nurse. As I speak to you, sir, opin phobia wa. It is because na opese yamau uniform allowance. Na opese yamau bibia yam famau. Now remember, say nurses for moko striker, mobusian foso eco hospital, they will not get access.
Motorists are also receiving more deaths as compared to the usual normal working hours, in which in the event that when the nurses were working, we had normal, the people are dying though, but this time round, I think that the death toll is increasing every day.
Strike no eda so ewo on. Ugo piemu anase na we piemu Ghana. Eda so ti de tie na nra. Amanfo call hospitals. A man nya yaresa. Doctors amanfo call fie because nurses fo ni ho. No man can admit patients no man for necessary steps mo ansana. Oba be do doctors for need to know. Ye ja bibiri kwa mo ko fie. Na rehosem old burger trends me breaky ediama won naked truth no say patience free mu amanfo edaneto people that had hopes sa enye nurses ya akọ strike ya enko omunkwa eda sukuta omo no na so kaye ho e watesfo asati so amanfo no papa no amanfo no maamenom ebinom yerenom ebinom kunonom ebinom namfofo ne adwumayefo ne ebinom asore ma free as we are speaking now. Menko the first account case number 1 the di kan see ne kase media amama boto mera ho se sikayo abo sikayinti yana ye somnyam kopon bo awrade no ya ye hwe ha manipa nyankopon se obo no se ne nseso no efrim watiasefo asase su na otena yakobon pa ye ben asati nyankopon first patients ne wofa nimpon na ode call hospital because of asthma attack yakodru ye no nurse ne wan a oba behwe no due to that yes say papa no I'm sorry.
So workers at Kolebu Teaching Hospital. And then my uncle had a serious asthma attack. He was struggling not from Nana or pray, but because you people are on strike, you refuse to even take care of him. Even after his wife was demanding, say, she's going to pay every amount. Ye profession, we are all human, so. A young man at the age of 30 years, he married just 3 years ago. 3 years ago, so yeah, this December will be 3 years. He doesn't have a kid. He had an asthma attack. Abraham wo fanda for more pray. I catch and you say you guys are on strike into unfan and co. Yeah, Damasi, he's dead. Yeah, the na question much. Yeah, Damasi. We are grateful to you people. See your profession soon share mumma yankai see any power. And you money and I be. Now so we are some men show your when men yana bonnet. He is dead. Yes, woo. Thank you to whoever they met there. Where do you want to know? Yeah, that's it. Yes, so yeah, the idea of we will bury him. A radimo where you man and kosu. No man quatenting. You, that person that was in charge. Near me, Yakran says, you said you are on strike. Into woman fanning kononko. Well, yeah, the na question much. Yeah, Damasi. Why? You.
We ne awehosem are to one of the patients. Now, in fact, there's alarming data be ever. But it's hard to be tracked for the amount. But yet, to say, among me, your mortuary, as and the numbers are increasing, jumping off. Now, I don't know, Anna, I prompted the health minister, Kwabena Mintah Akandoh, Papa no, I be church in Simu. Wamagana phone na anhu die ntia the John Dramani Mahama administration entimi emit all the demands are the Ghana Registered Nurses and Midwifery Association for omo conditions na omo so omo pen no die ntia entimi miti na ochemu a no krane se demands are nurses for a demand no almost starting May 2024. Kai say anopaya medical mouse update no mahu 2024 May under the Nanado Danko Akufo-Addo administration. Sa anomudidi mu a na amfree amfa and this administration by 5 months into the administration. Almost demands no mu demand every Nanado on the same demands. The same thing na mo penti for mom. And also assistance now. No Ukrainian go pani as a health minister. Ono Kwabena Mintah Akandoh wan kan jiro mo anoboa. Enye possible Ghana ntimi ntwa. Yentimi fulfill all those obligations. For now, ibeguso ane nkomotwetwe na ibeguso akoso. So say nti ase be ye adwuma. Na ye nurses for no. Ebe sha back. Ebe ye adwuma. Awe hospital. Kwabena Mintah Akandoh asem we do hwe tie this point party very well. Tie nie pa na me de asem we be kan asem a kire wo. Ghana be the rough. Ghana be the rough. Wo hwe naked truth. Our old burger trends edino maxi billion making sure say over subscribe and make sure say we subscribe we that. Na say subscribe as well time ni your subscription no come we subscribe move it to the left. Na ko like what like we na doma no so notification button no turn no so on. But before say obe share hit this share button there mo bia no. Amana hu the nurses for Ghana for why am for so health minister explanation Kevin Taylor and Captain Smart fire almost my fire. Before say me dey nu ba be shemu no e dey ama no make sure so the comment in the comment section I say do you think say nurses for no omu treat Ghana for fair or must swear secret of oath I say your secret of oath ni say at all costs you be bo nipa nkwa ho ban we are sure say secret of oath na mo so ye no omu di so anaso ma briti fato comment section na say fa mame yengo we Kwabena Mintah Akandoh ka che nurse for say onim said mudimas munye nyamadwe say bo bejam sisi yi enti all ka che retired nurses and nurse for na 1 year ago 2 years ago 3 years ago 4 years ago omu wie omu service na omu de 60 plus nti omu retire no or sere omu say opomacho omu mra akatwe bia say fata o say de mo omu bia no ya de mama omu Omu say omuko omunye nyemmere mmoro so saa. Enti kakran kakra ometimi na twetwa omo ho de. Ometimi na twetwa omo sustain issues no. So omo solve every incident omo ne Ghana Registered Nurses and Midwifery Association for ebewie. One who moves no. One kwapa nurse for no makọ strike na cho. Also rather opa omo makọ retirement no mo macho. So omo mra kai se nra be ka kire o. Se Ghana phobia sha se kasa. Se enkebe ya nurse for no muni timani abadoye na omo so omo strike for whatever reason no. Nka yenya omo na kwan fefefe. Yanka jomo say edomase. Mo mo san return back to the hospital bi you know mo wi. Na mom no ye be replace omo with nurses so far omo da so tifie omo nyanya adwuma nyeye. Ye be replace omo kama. Ye replace omo sa wi na adwuma na asi agbenya. Wei ene nsema minister Kwabena Akandoh ekai. Na owie no ana me say e possible say ye retired ones no e possible say betimanya omo wie no ye omo nyanya adwuma na Obedia di say nurse ya o hwe video yi 5 good years ana afei owie nursing school ye posting into baby ene bachere sache water na oton ai sweater ni enyu ene cycle ho ka bus na ekwa America mutu America gwa che car ana waye bia for 5 good years. Na we na odunfo bi enkomodidi e otosu no since that's obrofo ye wo de any school drop out ni bia aba de ma no so school de makọ kakra me enka me nurse ni ano sa ade na wo de enka me nurse no so ne kura kwanche se nursing school de wawie se si anka o train post na why na e ba post no o say from 2020 2021 e ba bi 2025 yi anas for do na de post o mo e de da ma bre to no de on na fie ma common no onko banko adwaman nti obeto nzu na we ana the story na breaking out at the same time yeah partners for be acho enye so mo salary ba but yeah Paul macho senka omo nye pnie no mgusu ye adwuma bra mgusu di omo nkomo ba mo so mo ko strike the same nursing for na ebi wie school 5 years ni yamfa na nkonko tie afna no ono aka na kosem kakra na yewie yedi sika bese 3,800 Ghana cedis e dey amount is aboa na mananya private hospital okwa ko yeduma aboa ahwe ama amanfo ko atom.
Is it?
I didn't expect this.
Don't worry. God will make a way for you, okay? He has already started and he will continue to do it. Okay?
Okay.
Don't worry. All that we discuss, God will come to. Just continue praying and he will do it for you. Okay?
Thank you.
Okay. So this 3,000. Don't worry. So put it, keep it safe and then continue. People have come to for you. It is not coming from my pocket or anything. Oh, you are making me safe here. So I'll call you. After one I'll call you. Right. Oh! And what if the major happen?
Yes, eti video na yeah this kind of man gama. What the time I saw it break here? Yes, hwe. Obi dwan mu ewu no bi nkwa mu ayede. Ka bo obi krama no. Amanfo so ba be chele afili. O ma be wen krama na mpa dipito afili. Ti sa pepepe. Edru time nurse for ese Ghana for munyi aye mo eboni aye for sika ese fata mo mfa maye no. Di here e extra conditions bi a ye expect say we be kan ho no. Ba ko ebi so awie a we nurse for corona 5 good years and 5. Deputy Finance Minister said men country ye nurse for ne Ghana for a omo person mu what is actually going on. Say ye mistake ka say ye twia sikana na conditions omo person ye di mo ni na ye nurse for ene ka Ghana mawu ye friends say Dumso levy say energy sector levy idea be kura busu. One Ghana put a busu no. Or sis a car say you tuma every year you be bo. Edia on that extra working condition and next for epe edia can you enjoy this year no. Ebe 2 billion Ghana cedis.
From the Ministry of Finance, we want to show our commitment to help in resolving this important issue, because our nurses are very, very critical to healthcare delivery, and we appreciate what they do. But the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure. And so we want to appeal to our revered nurses that we are willing to negotiate, to sit with them and the Ministry of Health to agree on a roadmap that will help us incorporate what can be accommodated in the budget for next year. And we believe that they have all seen the hard work we are all doing to manage the economy better. We want to appeal to them that they should let us sit down and discuss what can be accommodated so that we can all...
2 billion Ghana cedis. Where is somewhere now? 2 billion Ghana cedis. I don't know the Deputy Finance Minister, Thomas Nyako Ampem. I can tell you 2 billion Ghana cedis. Where the China, the agent, we the killing now, when I Captain Smart said, oh, send me busu. So, condition, working condition, I'm open. I said you a be young Quasia Sempa. Or say, the where the Casse. Wo now we are nursing you. Yemo disability guide allowance. Say, Onyonko now on the Juma hospital. No. I was in this in the one. So the bedroom fee nasa oh buana manako on the ward. Akoye Juma. And on Ozi and Jaka. We okay. Utia ya na utia form. I don't want to say. Or think there's a form of demands or try or the boss a kai. The working condition. Don't know your question. In fact, we pan a mujina so man ne amount for a papa no ma minimum padia. We need for Mom pe heaven na mako. The moye na hwa wo benya so agatwa e Ghana ya.
Omo pese omoji tools allowance. Now omo pese 7 Ghana cedis per day. Pacho nurse ben na okwa adwuma de ne pa na efrifie ko. No de kwa wo nkrofo no pon na wasande na de ko. Pacho e nurse me ya. Ha? Nurse ben e na okwa adwuma ono ade ne sika to sa de na omo de check ye temperature ba ko no BP ni ade e pese. Efideli ade check BP do. Why nurse ni be na ono ade ne sika to ne de a wo de ko adwuma na wasade wa de ko fie wo de a eti tools be na nurses na say yentua omo ho ka no mo kan kire me tool be ya bacho tool be ya mo ma ye hu na yenka bi ma mo. The next one now wo mo so mo hia ne say tell you physically challenged guide and a physically challenged transport. And no day almost say daily minimum wage for 27 days.
No we na say asem we de yentiase ma you go busa Kevin Taylor because Captain Smart there omienu ne breki o ne ta breki pa ti Captain fire ya na Kevin Taylor say onua wa gasa ya ma me baton no pan onso age ana say na nurse fo ye Choboy, and I'm this ye, Choboy, I'm this ye. I don't say, make catch us, Mammy perpetua ofori ampofo. Perpetua ofori ampofo yi, a oyemo president. President ma Ghana Registered Nurses and Midwifery Association no. Okunu, a na oye bright ofori ampofo. Na oye constituency chairman, edema MPP. Endina edu MPP time mami one more or the condition I got to since May 2024 you could July August September October November December 6 good months kai time I oka say mo fam bi mo dey nan to na mo nko strike aya abaya oba 7th of January ne 10th of June sa ben kro no abaya no in January June no ono ana saaba no na mo se mo holding responsible the money etna 8 years no mo jane life amano se muni ma mo life no de to checha no se ne mahamba bufu se kunkrom na ene retire next year de o mo bayi kai se yenya labor minister dada a o ka se eka ono nko anka ye expand ya na ye hwe kwa ye befa so e de age limit from 60 years a ye pension year na de akọ 65. Eti hedrin that I because 65. Ti anes fo iba na e almost start as a pilot program. Now we call retirement 1 year ago, 2 years ago, 3 years ago, 4 years ago. You don't me adwuma no mtimi yem adwuma ya bi pepepe a. Ne e fa nkwala ya yem fa omo di beka ho. So omo mentor omo ansa na omo kwanti. Ne 4-5 years na aka no. On fa nya adwuma de because kasedi ma ye mere. On fa mentor. Enti mo be ye den. Mo be ye den. Now, obi political ambition and politics for a share today, or say MPP for year the share today. And no me weird, was it the same thing? Get to talk or not, the same thing. Or so I can't say more next for Mama money me. Now, I'm trying free my me. And yes, I assemble Tomo. Hey, Mempemi was me. Ye, Ubia go far the camera. Mama, we can Ubia Fanko Kankamona. Mon president, Mammy Perpetua. Oforiampo for no or no MPP or the party Kevin Taylor as someone was crying.
Now this woman was setting up this strike. Nikruni. You see, this is the husband of this lady. Nikunu, your friend Bright Ofori Ampofo, constituency chairman, BNA Victory Walk, Saturday 23rd. November 2024. Nikruni bawumia and onigina ticket so. So dear Muhuno, let me tell you, this is the political part of it. Now I want to talk to the young nurses in Ghana. It's my amena olidi nurse for no. Or starting negotiations in 2024 May no. She never saw it wise. She said they have to put their tools down. But Abaiba power 5 months. Yati petroso inflation akonform meaning eduane bo akonform nyoma akonform no she still insists some form nyoma nguo na young nurses no entene fie intend me no ka say we are young nurse now hwemia I don't have a problem with you demonstrating or going on strike, but the question is this the reason why I end the opimphobia the moko striker? The question here is abina to sisiano. The honest truth is, we all know abandoned the 5 months. Your demands are money for abaya odi 8 years in him. Any abandoned the 5 months. Your demands you are demanding. You and I, we know that the government cannot fulfill all your demands. You people know, and it's a fact. The leadership of nurses, they are using the young nurses to do politics. And then I don't have any problem with a young nurse. The young nurse is relying on their leadership. But the leadership there is not thinking about the young nurse. As I speak to you, sir, opimphobia, it is because na opese yamau the uniform allowance. Na opese yamau bibia yam famau. Now remember, sir nurses for moko striker, mobusian foso eco hospital, they will not get access.
Aha. Kevin Taylor says nasimu boko. Asemna na medical board to fanda no. Said the wo honi asema ya asem ni ni. De kwan ba so na be so ye free wo. Na Your mortuary for Swakasa. Almost say, and ne, death toll na nearby, and Dawson. And then, as usual, say, Oko Confornochi, Coco Lebu, Oko Tamil Teaching Hospital, Oba Sunya Teaching Hospital, Ugo Pimo, Takrade, Cape Coast, and Nehon Konyaba, and Ganipa every day of recording on average. Numbers not control, but on team can number no because for now they a bit confidential. But numbers not control. Teachers and nurses for strike ya makwe. Among for pa. The much reform so can you go to you.
Mortuaries are also receiving more deaths as compared to the usual normal working hours, in which in the event that when the nurses were working, we had normal, the people are dying though, but this time around, I think that the death toll is increasing every day.
Do we have any numbers to back it? Where you are, what are the figures that we are getting?
No, I can't give you specifics. But what I know is that, for instance, we know averagely in Kolebu, you can have about 50. This time, right, has risen above that. Other facilities, Kompanochi and all that, we are hearing it. We know, but I can't give you specifics. There are too many too, unless I'm able to collect data in all mortuaries. But as we speak, there is enough evidence to prove that the death toll in our various facilities are increasing.
Maybe not get through the kit will be. Hey, nurse for much well secret of oath. Now so, and a month for you. Asmanti ubi epapa ubi yere kwa. Say Madika Canada, say Ghana no. Eh? They were Ghana no. You didn't have boneno. The only time I adwene nipa ho abra ye adwene ho. Say you were a selfish individual interest. The motivation and the zeal I anticipated to receive is so high. Na nkaka tira mi de ntia wo na go so e wood. Say obabo nipa nkwa ho ban. Na ye twia wo ka nya se adwuma ye ntwia wo ka. Plus other allowances and privileges I will enjoy. Now we say open extra working condition to better your working condition. Now no Ghanaian thinks or believes say you don't deserve more. In fact, who deserve more? Maybe we deserve more. Every single individual of us, Ghana, you deserve more. But we are all being underpaid. Apart from Article 71 for friends, government appointees for the public office holders for no. Everybody's been underpaid. Enti enya munkwa o ba yenka say enu nti no ma omunya mu de ni ye. Omunya ni ye. Ba o tu na mo so e na enu nti. Amanfo owu no. Aba. Now, this is the dire consequences. The Honorable Minister Kwabena Mintah Akandoh. The only more can omunya nti ase bebo bi na mu na. Ma me breaking down ma simple. The upper ten say on be power much o. Because what I say yes, we'll quote a date 2024 May, and I'm starting my argument on say more working condition. 2, mobile no me just 5 months old. Scapaba be a new one generated more. In the engineer so they are better condition amamo. And just 5 months. Africa the old cleans a lot of the hospital. Yakai, quite furious out of teaching hospital. The entire neighbors when you're teaching hospital are they are painty, baby. Cape Coast Hospital, who could do any painty. All because no chance here. Obom tuja. Enti enu go nye sika me na mo de aba mo generate a enti mo no ese mo workers ne ye better mo condition. And aside that, mo conditions na ma list no e be ridiculous. E be look madness. The fact that you want to enjoy that don't mean you should be unreasonable. You should speak without being logical in your thinking. Why then am we emotional on this situation? And yet time to babysit mo feelings so. We are resetting the country. Inti mo nurse for no say me ma be say mo reset e be reset mo brace amamo. Inti the minister na ga chem ni na say mama okay no problem. Retired nurses for kwanya be da ho porter na bi. Momra. Don't forget so many retired nurses are the next step will be the unemployed ones because omu here experience one for now to curb all the emergencies. Then they will start recruiting the new ones. Don't forget, a lot of them are waiting for employment. No more shame. With all your years of experience, 2-3 years is enough experience to train other nurses to be like you. In fact, most of our nurses, not to suspect, but most of you are bogus. I'm for losing or more parents, or more family members, or more friends, because of negligence, because of some lazy attitude of some of your nurses. And then we are angelical behavior being in a way we are in hospital. Time to was last. I don't know minister they catch them. Now the third one. One I can say you can some allowance grab was into Montuaba. One also the allowance will be in Ghana. Politics in 70 years. No government is supposed to be paying allowance. National allowance. Government paid on the Gazutia. Teacher training allowance. Government paid on the Esotia. The reason why I introduced that allowance I kick a trim than other. I didn't. First, I say I'm from Peko. And I use as motivation. And the mama say I'm from Ko. In the end, I abuse those powers. No, I am a chop money. I don't have a boys in Yama music. I would be. And as I'm only me for the nursing poor. Said admission fee the boy no. Obey your whole stubborn no room. Now we are the allowance and I transfer the world half far. Meanwhile, the same people are only secondary school and as senior high school. No, or to university or student loans. Now, no, the party on. Oh, yeah, the party on. And then say I'm a 50. I say I intimate family every year. No more school and year postimo. Rotation, we go do rotation now. Allowance I be channel. Any allowance or more university channel. The way university on what that's the student loan car dated no. Wo ya more allowance rotation sika say accumulate na ba and no want to be next ni bia brabo. As soon as start the next eduma. And some of you are found properly. I be trying to go. There are certain benefits you people get that other professionals omunya. And what is this? Move blow things out of proportion. They be enjoyment now. More enjoy and say do some you try Ghana. Come on, Ghana Ghana yebo. Money more allowance for rotation. You for money service. Say amount for service can be pay. You for sure only the same thing. You enjoy certain privileges the country is providing for you. Now, okay, allowance them out because of papa and the trip, tax in the tax, and I'm having a trade in the tax, my. Huh? Allowance near the mom. Okay, papa, no, this is going to be towards the mom. No tax is going to be him. Nippon and the wager and the old the tax, second, the mom was an allowance. No dear. Rotational money near the mom was dear bar. I'll complain the bar. Maybe do some metal car, a bit do some metal assassin, a bit do some one. Says the cannon. Sasikano. Yeah, taxically, they were nonsense. So, because certain allowance, you meet certain conditions, you want people to die. The same people who fed you, the same people who took care of you with the allowances, the same people are the reason why who started with nursing career, knowing a good amount of money, or they start to career. Or moon also women say, who know. I was a money. Huh? Once a money. But the money amount for political figures here, money much here, no more for money politics. Say mo ya kwadufo dodo na ya kwadufo nti o be fie kura kwakoda nti wo mti strike enko be kokora honko wakoda the onka GRNMA for honkra osukura wakoda because the Ghana Research Nurses and Midwives Association for draw Snapchat ne TikTok for but mamu nya sanse mu no papa na muom no monkafra wate mama ketwa na omonya no manti ye ya muni na you say papa wo but born in a woman cat born in a woman yet the infant from an MSA you be ye free and again the middle class who already we no say oh your nurse say near catch you say 2 billion and the basic car 2 billion Ghana cedis and yet 2 billion old currency 2 billion new currency 2 billion 2 billion. Now MPP for Chama won to me. He did 15 million Ghana cedi kwato so say 500 billion omun to me. O say for 2 billion and make a wage bill na Ghana no ye de Canada ye de kam. Nje san ko bobusu yan fa betwa muka. Na ye fa meto taxpayers for. Ba ha bo ne ben. Yan ka se mo nye modwuma nye essential, very essential. Mo very important, you are well needed. Someone kan ho a enye yie, especially in times you forget your roots. I the traditional way na near the helium into full scientific and laboratory and then medicinal uses no ye hiamo. And also interest you should be unreasonable when you are dealing with us. Na bankum we adware different and different adware bankum. Me naked truth any edi no nim that a maxi billion life on old bogatres making sure say obe subscribe obe like na wa share unia anya bi ahwe. But before that for comments no at the comment section na say Ghana and nurses for striker omko yenti or this year baako ama account of ne wofa asma attack nti kwaya of aso efrimo. Ghana Health Minister Kwabena Mintah Akandoh say yan kan che Ghana for say your nurses for the demands no making it started from May 2024. Every this time around negotiation no dey also we here no adoso nti emre mu je almost retired nurses for so omra back na omo meye dwuma Ghana and say ni omo ebewie na omo free omo strike no back na Deputy Minister of Finance Thomas Nyako say men kan kire we say 2 billion e ka ba da hodi ama Ghana every year say jitu me say betwea conditions are next for omo penny na Captain Smart say conditional next for the ba name kwase asem nyansa ni e do too ridiculous. Anna Kevin Taylor to say the prophet or see young country or say or digging information or clear watching now perpetual ofurian pofu are the president of Ghana Registered Nurses and Midwifery Association Nikunu are bright ofurian pofu AMPP constituency chairman na we know politics there no the guests na no so munim ana omoso enam kwaduro nti omoje atuma omudi akire onka omohwe kose say retired nurses for the ba na sha say fa manfo furo kan ho a ono mo say omutu atwi besuma hiti abobbo ma adwene de me feel e for this entire situation na e course on there eno ho fa so de to comment section na say for mama we had a sam ni beji me feel pa maxi billion naked truth on old blogger trends makra